Hello and welcome. This morning we are doing a corrective exercise training session. These exercises will help us to prevent forward head posture and rounded shoulders and really help to alleviate back pain, shoulder pain, and knee pain according to the lifestyles of sitting and working on computers. So we're going to begin with releasing the muscles in the chest, and for this you'll need a small ball, something like a tennis ball, or this is called a massage ball. There are some specifically designed. Lacrosse balls also work, but they are a little bit slippery, and some people find lacrosse balls to be kind of hard. So you'll just stand at the wall, and you'd like to make sure you work in the muscles in the chest, just like this below the collarbone, and also out right by the armpit, where the pecs attach. But now I like to use a door frame that allows you to get your head out of the way. So you might feel it's a bit tight, particularly as I said, under the arm and at the edge of the collarbone. Do start at the chest and work your way out toward the outside to the shoulder area. And then we'll work on the other side. The arm that you're working on, the hand should be facing the wall. So the palm of your hand is facing the wall. Make sure you're not turning it the other way. If your hand is facing away from the wall, that means you're internally rotating the shoulders, which is a big factor in rotator cuff discomfort. And the head also, so that you don't strain your neck, your head should be turned away from the ball side. All right, that was great. So this often comes up in my life, the question of neuropathy and balance. So we're going to next use the massage ball. If your balance is really not that good, then you're welcome to do this seated in a chair, if you can, or hold on to a chair or something for stability. But obviously, it's best if you can just stand freely. So we're just taking the ball. This has become quite popular. And you can roll it around as you feel comfortable, longitudinally along the arch. It helps to lengthen the plantar fascia. And I like to work in the forefoot as well, and on the outside of the foot around the heel. Now, because here, those in our regular training sessions, we do this regularly, it's amazing how much better your feet feel. Usually when people begin with some of this type of work, it's quite uncomfortable, but your tissues will become healthier with practice. Okay, for the next segment of our training, we're going to need to lie down. And some people, I know it's difficult to get up and down off the floor. I would encourage you to try to do that if you feel you can. But if not, then you're welcome to lie down in the bed. And we will need a few different items. Today, if you don't have them, if you're new to the classes, to these sessions, then you just forego the implements, but do the particular positions. But one item is either a weighted bar, if you have like a 10 or 20 pound weighted bar. I just use a broomstick. And something like a small Pilates ball, many people have. Or I just actually use, this was a beeswax candle. But something that's about 6 inches wide. You could use a can, even a can of food. And then a couple of straps. Ideally one that's like a yoga strap that's not stretchy. So here I have this karate belt. And another type of a band. The other band that we use is for, you put around the legs, they're called mini bands. And they're this kind of a size that we'll be using around the legs. So we're going through an entire series, as I mentioned, to even out our alignment. All of us, in our lifetimes have acquired different imbalances in our bodies, and we need to put ourselves back in order because we have a lot of fun things to do. Life is great when your body's functioning well. When you're stuck at home, can't do anything, it's not much fun. Okay, so here we go. Now this massage ball work, soft tissue, you could call it myofascial release, are popular terms. We're not going to do it too extensively today. But we're going to do one more area here, and the muscle is called the TFL, the tensor fascia lata. It's right here, like when you bend your leg at the hip, right here, there's a little muscle that attaches the IT band. So it attaches basically your leg onto your pelvis, right in this little crease. And so we're going to just lie down on your stomach, on the balls on the right side, and your head should be turned away from the ball, so your head is turned to the left. I'd just like to lie right down. And you'll need to lift the hips a bit so you can feel the outer edge. And some people it will be really, really tight, particularly again, if you haven't done this before. Those of us who've been practicing it, you know, you just feel a bit of a cable at the end, which is exactly what you should sense. Okay, and now we'll put the ball on the other side. This muscle, it's a very small muscle and often gets strained. When we sit, our glutes, our buttock muscles, don't do their fair share of work. And the next factor is that this small muscle has to do their work and often becomes strained and very tight and creates referred issues in many places in our bodies. So this is a really important one to tend to. Okay, so today, we don't do this every time, but today I'd like to spend a little extra time with regards to the neck, again, the forward head posture concern. So I hope this is quite clear. So you take the ball. Now, some people can't get your head to the floor. You can use a pillow or a book. I'd like to do it on a book. And the ball is situated so it's not in your neck actually, but up in the skull just a bit, such that it makes your chin pull down toward your throat. So I know people don't like thinking about the double chin, but that's the kind of angle actually of the neck. And we're just going to relax here for a moment, try to relax your shoulders. And here we're going to also work on our diaphragmatic breathing. So the diaphragm is just below the rib cage, helps the rib cage to expand. And the way that we like to think about diaphragmatic breathing is most people just imagine that the belly, you try to expand your belly, and that's true. However, I would suggest rather think about or envision a balloon in your stomach. And when you breathe in, the balloon expands in all directions, to the front, to the sides, and to the back. Now, as we go through this series, we want to avoid breathing in the chest and shoulders. So do not allow the ribs to lift. So as you breathe, the lower ribs should stay down in your body. The shoulders, there should be no tension in the shoulders. Keep the chin pulling down toward the throat. And as we're doing this, the position of your neck is helping, it's like traction for your spine, so you're elongating the spine. I'd like to do this to help prevent degenerated discs in your spine. And you'll feel it, right? Your lower back will relax. Some people, the back of your neck will be really tight, so it's not going to feel too comfortable. But if you keep practicing, it'll start feeling better. Probably some of you already have degenerated discs in your neck. So we'll try to take care of what we have. The next action is you keep the chin, shoulders relaxed, and just not a big nod, but gently nod the chin up and the head up and down. Now hold your head with the down position and breathe diaphragmatically. Feel your waist expand to the sides and exhale. The waist comes in, squeeze your waist in. Again, the eyes, the head nodding up and down. And breath. Relax the shoulders again, one more time, nodding. And breath. Okay, next exercise, you keep the chin down, not nodding the head. Lips together, teeth apart, tongue at the roof of the mouth. This time, hold your head in exactly this position and only with your eyes look up and down. Continue looking down with your eyes and take a breath. This action of the eyes helps to alleviate tension in the suboccipital muscles, which are the muscles in the back of the neck. Okay, eyes up and down. Eyes looking down and breath. Once more, eyes. And breath. We'll put the ball aside. We're finished with that. There's one more thing to do for the neck. And I just, be careful with yourself here. Don't strain your neck, but it is quite strenuous. We want to strengthen the deep neck flexors, the muscles of the front of the neck. So just keep the shoulders relaxed, your legs relaxed, chin pulled down, whatever you can do. And if you can manage, just lift the head off the floor a bit. Now, if it's too strenuous for your neck, no harm, just keep your head on the floor. And breathe. Try not to use your legs and your shoulders. Relax the head back. This strengthens the muscles in the front of the neck to prevent your head from falling forward. Tuck the chin. If you can do it, lift the head, just stay here if that's too strenuous. Keep the shoulders back. Relax. Inevitably, with practice of this, your neck will become longer. I see that all the time. When you look in the mirror, you'll notice that your neck is much longer. Tuck the chin one more time, keep the shoulders relaxed. Head lift. And rest. Okay, that was fantastic. So next part of training is the hamstring muscles. So hamstring muscles are these muscles in the back of the legs. And for this one, you'll need the strap that's not stretchy. A stiff strap is better. So we want to actually even out the tension in the hamstrings, actually all down the legs, the hamstrings, calves. But also we want to build resilience. Resilience is elasticity of the tissues, so to keep the spring in your step. So for that purpose, the strap, you see, goes like this under your foot. And the knee, we'll start with the right leg. The knee is over the hip. And when you start with the leg is bent, and then straighten the leg, only such that you feel the stretch in your hamstring muscles, in the calves. You should not be feeling this completely behind your knee. A little bit, yeah, but not too much. You should mostly feel it in the muscles in the back of the leg, but not behind the knee. So your calves and hamstrings. And now bend the knee all the while, Keep the knee over the hip. Don't let your knee come toward your chest. Keep the double chin position with your head, and then straighten the leg. Whatever you can get. Okay, now for resilience, you do it like this. You pull with the strap and push with your foot. So you're applying force, you're lengthening the tendons and strengthening the tendons down your leg into your hands, your whole body. We keep the rest of your body relaxed. Your left leg not participating. Okay, and then again, bend the knee. And one more time. And if with regular practice, you'll notice that you'll get better, more ability here to straighten your leg. Again, don't just try to straighten it. You want to feel that hamstrings and calves stretch, don't strain the back of the knee, that weakens your knee joint. Push with your foot, pull with the hands. You might feel that into the hip, I definitely do. Okay, the other leg. All right. Okay, so it's in the foot. The foot is flexed position. Then as you straighten, whatever you can get, might feel a little tighter than the other side. And pull with the hands, push with the foot. Make sure you don't hyperextend the knee. As I said, you don't want your knee straining the back of your knee joint. Keep the toes pulling down. Then bend the knee. We'll do that twice more. Straighten the leg. Keep your head centered, shoulders even on the floor. Be sure not to roll over to the leg side, the lifted leg. The right leg is relaxed. Keep the chin down position with your head. And release that tension. And one more time. So this is not just a passive loose stretching. You're applying force and strengthening as you're doing your stretching. And just pay attention, your legs should be straight, the knee and the foot, the ankle should not be twisted. All these little details we'll pay attention to. Fine. Okay, now we're finished with that strap. And next, if you have a broomstick or a weighted bar, and it goes like this. This is a pelvic alignment exercise to even out the alignment of our hips and our lower back area. So it goes the right leg closer to you, knee over hip, the left leg is the further away. And the arms are straight, double chin position, and press the legs into the bar. So the right leg you're pushing away, the left leg you're pulling toward you. If you get cramping in their hamstrings, you'll just relax for a moment and try again. Usually you can reinitiate. Good. And reverse the leg position. Shoulders are down from the ears, head is centered. Press the legs. Left leg push away, right leg pull toward you. So you know that pressure in your hamstring muscles and in the quadriceps, the front of the thighs. Sometimes when people first try this, it's quite sensitive, but as you practice, your tissues will become stronger and you won't feel that discomfort. Reverse the legs. Okay, now the lower back area and your hips should be centered on the floor. Avoid rolling over to one side. And press the legs, keep the head also centered, straight elbows. Don't let the shoulders roll in toward each other. Switch. Be sure that the lower back doesn't arch. So you have to brace your abdominal muscles. Press the legs. Keep the legs centered. Sometimes the right leg here will tend to veer out to the side. So the beauty here is that you're evening out the strength and tension of the front and back of the legs. Okay, now right leg again. So right leg is closer to you, left leg is further away. You should notice your abdominal muscles will engage. Reverse the legs one more time. Make sure you're breathing into the diaphragm the way you described earlier. Okay, and we'll put the bar down. Okay, now here as I said, I have this beeswax candle. It's quite nice. This next maneuver is for activation of the gluteal muscles. So the buttock muscles, right? There's muscles on the sides of the hips and the back of the hips that help hold your legs in place. So we're actually working the full range, the full circumference of where our legs attach into our hips. Arms just by the sides. The balls, you can use a soccer ball. Like I said, you can use a can of food. Pilates balls are really good. You can see how this is set in place. So it's just like that between the knees. Okay. So make sure the feet are the same width as the knees and the toes are pointing forward and the arches are up. Big toes on the floor. Big toes are on the floor. Don't roll to the outside of your foot. Right hand on the lower ribs to make sure the lower ribs stay in place. Now you don't want to, see here this lower back, you don't jam the lower back like that into the floor, but you want a little bit of a gap from the floor. But the action is that you brace your stomach muscles, so you should feel contraction in the abdominal muscles. All right, so right hand on lower ribs, shoulders are relaxed down from the ears, double chin, brace your abs. Squeeze your buttock muscles, squeeze your glutes from the sides. So it's not a pelvic tilt, not at all. From the sides, like you squeeze in the sides of the hips, and you'll feel that will brace your hips. And now squeeze the knees into the ball. Keep the shoulders relaxed and breathe into your waist. Your belly will expand. Relax the shoulders. Okay, just relax your hips a little. Then switch, left hand on lower ribs. So we don't want the ribs to go forward when we do this. Shoulders are down. Brace your abdominal muscles. Engage the glutes, squeeze the buttock muscles from the sides. Then squeeze the knees and hold. Hold that evenly, the hips, the knees, holding evenly in all 4 points. Try not to just use your groin muscles. This contraction will help hold your knees in place. Then relax. If the hamstring muscles, the back of the legs cramp, that's generally because you're bypassing the glutes. So that's why we do glutes first and then the next, whatever. So double chin, shoulders back, abs, glutes first, then knees, hold and breathe. And recover. Okay, and that was to activate our buttock muscles. So we wake them up after we've been sitting for hours. And actually, when you do this early in the day, then later on throughout the day, even though you sit for a long time, your glutes will still remember to work when you get up. All right, so next here we're working on rotational core, so stomach muscles. but not just like crunch thing, no, but rotation. All day long, we're turning around, getting in and out of a car, sitting, getting in and out of your chairs. And so if you have a big stability ball, you can hold on to that. I don't have one here, so I'm just going to wrap my arms as if I was holding on to the big stability ball. And then you lift up the legs the same way, so you're wrapping your arms and legs around the big stability balls. And then we just rock to the sides. Now, if you're new to this, and when you rock, your body, you just collapse, please don't panic. That's okay. Most people do. And even people who have like so-called strong abs, right? They do a lot of crunches or whatever, which I wouldn't suggest. But the rotational core muscles are often weak. The muscles when you move side to side and when you turn around, when you walk around your house in circles like that. So tennis players, golfers, those rotational kind of activities. Walking is a rotational movement. So if you're falling apart, when you do this, you can just hold this middle position and do a slight rock side to side, like an inch or two. Now relax the arms and legs. Okay, now the way people compensate, often they let their heads get really tight. So let's bring the arms up again, legs up again. Do not lift your head off the floor. Keep the chin pulling down. Your neck should actually be quite relaxed here. Use your abs. Brace your stomach muscles. Then slightly rock to the side. Pull your stomach in and exhale to come back to the middle. Then you rock to the other side. Just a small breath. It's not a big breath, but if you just pull your stomach in, and that will help you, you'll be using your diaphragm and your internal abdominal stabilizers. It should feel really easy, actually. It's quite comfortable once you get stronger. And those, if you are just collapsing to the side, like you can see, you shouldn't be pushing off the floor. Ideally, you have enough abdominal control that you just use your stomach muscles to help you. All right, and then we'll just lie down again. Relax the arms and legs. Now this is something I like to do frequently, and you bring the arms out like the letter Y, palms are facing up. So this simple position here will help get better circulation and nerve conduction down your arms. You know, many people have tingling or numbness, even, you know, your hands, arthritis and all that. So just lying like this will help the blood flow down your arms. Okay. Now the next layer here of our training program today is abdominal strengthening, and we're going to do variation of plank positions. On Saturdays classes, that's tomorrow actually. So Saturdays we do dead bug variations. Today we're going to give this a try. If you're like very weak with your abdominal muscles, then you can, you know, just do more simple variation. I'll describe it. So one, you can just go like this. The elbows are on the floor. Shoulders or elbows are directly under shoulders. Toes are curled under. And you just brace your abs and keep the shoulders down from the ears. You can do that. When we lift, you can do, you know, just keep the knees on the floor and just lift a bit like this with the hips. Or you can come up with, you know, the knees coming up off the floor. We're not doing it for hours. That's not the point here. We're just going to do it intensely for 10 seconds. If you don't mind, we'll do this all together here. Okay, so the elbows are under the shoulders. You have your double chin position, shoulders down from the ears. Your shoulder blades, they're on the side. So think of your side ribs just under your armpits. Squeeze in there. The serratus anterior muscle you should be engaging. Okay, your toes are curled under if you can do that. Squeeze your glutes together really hard. Use your legs. Brace your abs. Now this is the time. Brace your abs really firmly. You've got all that going, all those different things, and then lift. And all the time when we're holding, squeeze in from the sides. Use your glutes, use the sides of the ribs, under the arms, use the serratus, use your abs. Keep the chin in the double chin position. And breathe, oh my God. And release that. Okay, now this, I love this exercise, I hope you're good with it. Forehead goes down. The elbows are in line with your forehead. Palms are facing the floor. This time your legs are straight, toes not curled under. Your legs should be completely passive. Your hips are passive, lower back, nothing going on. It's totally relaxed. Then you breathe in. And when you breathe out, press the elbows into the floor such that your head and chest slightly come up off the floor. Shoulders down from the ears. There's no tension in your legs and back. So what you should feel here is the muscles in the front of the shoulders, the rotator cuff. You're building up the strength of your rotator cuff and decompressing your chest so you can breathe. And now breathe into your belly. Keep the double chin though. This is to help open up those tight chest muscles that happen when we sit for a long time, even like holding on to books. Okay, second set. We're doing this 3 times. So back to the plank position. Shoulders. Okay, elbows are pressing down. Shoulders are down from the ears though. Double chin. Brace your abs. Engage your glutes. Toes are curled under. Lift however you want to. Hold. Shoulders down from the ears. Squeeze the sides in. I know it's hard to do. You're just working hard here, only 10 seconds. And relax. Okay, and then forehead down again. The elbows in line with forehead, palms down, legs are straight. Legs and back relaxed. Shoulders down from the ears, press the elbows, lift the head and chest just a bit, and breathe into your belly. And when you do that, you should feel like your diaphragm, when you breathe into your belly, it lifts you up. So this is your great opportunity to strengthen your diaphragm. Okay, forehead down. One more time. Okay, elbows under shoulders, toes curled under. Okay, engage the sides, this under the armpits, the serratus muscle. Brace your glutes, abs, lift, hold, double chin, breathe. Release. If you feel it in your lower back, you absolutely should not, like 0. It's because the abs and the glutes aren't strong enough. That's why we did the other exercises first. Okay, one more time, forehead down, legs relaxed. Breathe in. As you exhale, press the elbows, and the shoulders come up just a bit, and breathe. And just relax here. Okay. So that was to build, the front of the house. You make this part strong for your abdomen strong. You could see your whole body's working. However, one area where we're really, really weak in our culture is the oblique muscles, the muscles here on the sides. Once those get stronger, you'll have way better support, and you'll be able to do much more things in gardening and walking up and down stairs and things like that. Rolling around, Yeah, just rolling around wherever. You have to turn over in bed or something, get out of your bed. So we're going to next work on this side bridge position, so people are familiar with this. Even though you maybe you're very competent, you can do it on your arm and all that on your hand. I would like you to please give this a try. Because we really want to make sure you're using your obliques. And not compensating by, twisting necks or just using shoulders too much. There are 3 variations we're going to offer here. I'll just quickly go over each and then you can decide. Option 1, you're just like this, you keep the hips on the floor, the knees are bent. Option 2 is like this, you hip hinge. So you just stay, we're doing knees down. I know you're strong, but we're doing on the knees for today. And then the third, the most challenging option is this band. That's what it was for. It goes around the legs. So many people are familiar with this clam type exercise. So we're incorporating that hip external rotation along with the oblique stabilization. All right, so we're starting on the left arm. You can decide whether to keep the hips down, lift the hips up. Now, when you're lifting though, it's not, okay, just, can everyone watch this? It's not like that, you don't lift up like that, it's hip hinge, so you bring the hips forward and up. A hip hinge, just like you're getting out of a chair idea. Okay, left arm's on the floor, the heels are together, feet are flexed. So press the forearm into the floor, and you can stay like that, or you can hip hinge, hips come forward. If you want to, top leg comes up. But keep the hips all the way forward properly. And breathe. We're holding only 10 seconds. Oh, if you have to stop early, do that. And just don't worry about it. Okay, hips back. No, I would suggest sit up. Take the load off your shoulders so you can reset properly. Now we're going to train this pattern of rotation. So we're rolling down, your legs are straight, elbow down, bend the knees, feet are flexed. Press the forearm, brace your abs, brace your obliques, hip hinge, bring the hips forward, all the way forward, keep the head centered. If you want to, leg up, hold, breathe. Leg down, hip hinge back. Now wait, straighten the legs and sit up. Excellent. You should feel this left shoulder, yes, you're strengthening the shoulder and also on the muscles on the side of the torso on the left. Left arm, bend the knees, press the forearm into the floor, keep the head back, hip hinge. If you want to, right leg up, hold and breathe. Keep the head centered. Keep the shoulders strong. Knee down, hips back. Straighten the legs and sit up. That was really good. I must admit, this particular exercise is most commonly the one that people don't like. Like most people, when I say, oh, do you want to do, they don't want to do it. However, I mean, obviously, we know we need to do it. So, if you don't like it, you just do the easy version. Don't worry about, that's okay. As long as you engage the muscles on the side. Okay, right arm is down. Press the forearm. Hip hinge, so the hips come forward and up, hip hinge, that's perfect. And then left knee, if you want to, you don't have to, but if you want to, that's good. Head is centered, head back. Knee down, hips back, straighten the legs, and then sit up. Wasn't that easy? Okay, so most people, the right arm is quite a bit stronger than the left, or the right side, the right obliques. Okay, right elbow down again. Okay, the feet are flexed. So you've got double chin, press the forearm, hip hinge up. left knee, hold. Leg down, hip hinge, straighten legs. So just a word of caution, don't use your legs, you shouldn't feel it in your thighs or groin. You really want to focus on these oblique muscles on the sides of the torso. Okay, right arm. Feet are flexed. Double chin, press the forearm, brace your oblique muscles, hip hinge. Left knee, don't use your quads, think of using the side. You can feel your glutes, that's true. Not the front of the legs, not the inside of the legs. Okay, leg down, hips back, straighten the legs, sit up. Perfect. And we'll take the band off. Okay, next we're going to stand up here, and then just take a moment. And I like to just put everything away out of the feet. How do you get up? Oh yeah, how do we get up off the floor? So if you want to, you can do this way, so you come up in the crawl position and then walk the feet forward. And as long as you keep practicing it, you'll always be able to do it. But I can guarantee you at some point in life, if you don't keep practicing, you're gonna go down and think, oh my God, how am I getting back up? So not to worry. In our classes, we deal with all of this. And it's really very exciting because everybody's way more capable. Whoa. Oh, actually, I have to demonstrate something else. So there's, next thing we're doing is a postural restoration position. And this is to help you, everything we just did is great, but we were lying down. So we have to have all that muscular control when we're standing up. So I'm just going to take a moment here to demonstrate the feet, what happens with the feet. Okay, so here you go. I've got these pens, these markers. Okay, I like to use acorns. You can see I have these acorns. So the feet will be like this, and you can put the tip of the pen, can you see like that, just like that under the arches? And it's the similar idea, like you see like that. Or I use acorns like this, I just stick it in the arch. So the purpose is that it activates your arches. It's not a support, believe me, it's not a support. It's like when you walk on gravel and bare feet, your feet get really sensitive, like you can really feel it's digging into your feet. And so the muscles engage. We want to engage your arches. So that's the purpose of putting the pens there. Okay, and now the band. If you want to, you can use a band for this. So I have the stretchy band, the same one we were using a minute ago. When we put it on, I always stop, take your time and focus. The band goes just above the knees. The feet and knees should be like the same width. Don't let your knees collapse in. It's really important. Don't let your knees go in toward each other. Okay, the toes are slightly angled out, not very much, but the knees and toes are the same angle. So you've got your pens or acorns that go in your arches. You don't have to do that if your feet are really sensitive. Over time with our classes, don't worry, they'll get stronger. Okay, now the elbows come up like this, like as if you're holding onto a basketball. And then you want to squeeze the basketball with the elbows, keep the shoulders down from the ears. You should feel tightness like here, under the armpits, okay? Double chin, brace your stomach muscles, brace your abs, hip hinge back. Keep the knees out and big toes on the floor. And just keep squeezing in from the sides. So you should feel your shoulder blades on the side ribs, your glutes on the outsides, and your arches should be engaged because the pens are pressing into them a little bit. Okay, stand. Okay, now we're going to incorporate the neck with this, the neck action. I just want to demonstrate though, because people often like let their heads go forward. So the neck action, if you can see here, you don't do this. Okay, your chin is pulled down and then you just try to turn your head to the side. We're strengthening the muscles to hold your head on your body, just like babies do. Just like babies do when they're in a crib. You know, they try to turn their head or whatever. So we don't, not forward head posture, keep the chin pulled back. All right, so we've got those acorns in place, or you got your pins in place. Elbows up, squeezing the basketball, hip hinge a little, keep the chin, double chin, and just turn the head to the sides. And relax. Okay, same idea, but this time you're tilting the head now, not bending the neck, just tilting the skull on top of your spine. Elbows, double chin, brace your abs, hip hinge, knees out, big toes down, breathe, and just tilt the skull a little bit on the top of the spine. It's called the occiput. Okay, and recover. Bring the feet together, not knees together. Okay, great. Then we'll take these bands off. We'll finish with the bands. That's great. Okay, and now walking around a bit. Now that was fun. So I just want you to notice when you're standing at this moment that you feel taller and you just feel more stable and more strong. That's the point of these corrective exercises. I'll just walk around a little. This is just a bit of recovery. Yesterday at the park, I was watching this young boy. He's really cute little kid, very talented athletically. And he's been on the skateboard park on a scooter for days on end, for hours. He's really talented. However, like he's always like leaning to the right, pushing off with the left leg, leaning to the right, this kind of pattern. So what happens later in life, right? And we know that later in life, like we end up walking like this. So we need to prevent that from happening. If we have something like that, like we can correct it, and this is how. We're going to now work on the feet. So our feet atrophy, that means they lose muscle tone 33% faster than the rest of our bodies. I guess I'm gonna have to show this one more close up too. So this is to strengthen your feet and ankles. When we wear boots, our ankles start wobbling around because the boots give too much support. And so when we try to like stand on one foot, like our ankles are going like this and we can't do it. So we're going to stand like at the wall. So the edge of the wall is like this on one foot. And you just have the edge and you want to have contact. So the first time you see my foot is flat. The second time, if you want to, you don't have to, but you slightly go like that. So you'll slightly lift the arch, right? So your foot's against the wall and you lift the arch just a bit. Starting with the right foot, and the reason we do this actually is to prevent neuropathy and to rebuild the nerves down your legs. When we drive cars, you know, the angle of the right foot, people tend to lose sensitivity on the outsides of their feet. So I'm standing, the edge of the right foot is against the wall. We're going to take the feet a little bit wide, like kind of like a surfer stance, but not quite that wide. So the edge of your right foot is touching the wall, the entire edge, from the baby toe to the heel. Body is centered. Now just think about the outside edge of your foot. Knees are a little bent, you can see, knees are a little bent. And you just press the foot in toward the wall. It shouldn't hurt, you shouldn't feel much going on at all. If you're having any discomfort, don't put pressure, just keep the foot there and focus on the feeling your foot. Relax a little bit. We're going to do that 3 times. If you're competent here, then you can really like apply force, like press. So you feel your leg working, your whole body is working right up into the hip. Make sure you press the heel, the outside of the heel in toward the wall. Don't let your head go forward. And release. Don't be surprised if you're a bit sore tomorrow. I know it doesn't seem like you're doing much. Okay, so press the foot again, but you're reactivating muscles that maybe have been sleeping for a while. And you might notice that your legs will be a bit sore tomorrow. I'm sure many of you have friends who have neuropathy. I would like to avoid that. And if you do have it, I would really suggest trying to do this. Okay, that was perfect. Now we're going switching sides, left foot. So the legs are a little bit wide. So it's like, this kind of position. This is a strong athletic position. Like wrestlers when they get, or boxers, they go like this really strong. So outside of left foot. The right foot should be directly in line with the left foot, like don't let your right foot go back. Hips are square, shoulders are square, and just feel the entire edge of your foot. Now, many people also I know have sprained ankles in the past, and that weakens the connective tissues around your ankles, so they get weak. Okay, relax that tension a bit. Okay, again, so hip hinge just a little, your knees are slightly bent, press. You shouldn't feel this in your quads, well, a little bit, but not too much. Just press the foot, so it's the heel, and right from the toe to the heel, feel that entire edge. Again, you might feel it into the hips, at the back, the sides of the hips. Don't let your head go forward again. Okay, stand. Okay, one more time. Now don't forget to breathe. I personally feel this right up into the abdominal muscles, the obliques on the left side. There are anatomical reasons for that. Okay, recover. And if you just walk, just notice how you can feel the outer edge of your feet again. That's why we're doing this. And notice as well how your arches are engaging more. Okay, now we're doing this again, but this time if you want to, you lift the arch a bit like that, you roll the ankle slightly. If you don't want to, you don't have to do that. However, this time as well, the feet are a little closer together, so you're standing more vertically, not so wide. Okay, so right foot again. So as I said, if you want to lift the arch, make sure that you're centered though, like don't lean your hips toward the wall. Now press the outside edge of your foot. And relax that tension. And then again. Make sure you're pressing from the toe to the heel edge, all the way to the heel. Shoulders should be directly forward, hips directly forward, head centered. Relax that tension. And one more time. This is what I mean, like if you're doing this and you can feel your legs working like that, you'll be really surprised. Like tomorrow your legs will be kind of sore, like you did some really hard work, which you are doing. You're regenerating your nerves. Okay, good. Just rest now here, the left side. So edge of left foot against the wall. If you want to, you lift the arch. And we're square. Okay, so you might feel this up your left leg into the glute. You should feel it in the hip muscles, but really not in the thigh exactly. I think most people will feel the outside of your leg. This definitely strengthens the knees because you're giving support to the sides of the knees. Relax the tension. Just relax. And again, press the foot. Relax the tension. Once more. And really focus on the edge of your foot. Good, and rest. And again, when you walk, notice how your feet are far more supportive. Okay, there's one more thing if you have time, if you would like to do. The next exercise is, that was for the sides of the ankles and feet, the sides actually of your entire body. Next we want to work on flexion and extension. That means when you walk, your ankles should do this, they should bend. A lot of people walk flat-footed. So for this purpose, we're going to go back to sitting down on the floor, or again, if you want to, you can sit down in your bed. And you will need a strap. Again, ideally one that's not stretchy. Okay, so the strap, here's my strap. Now this is really great to help prevent neuropathy. We're starting with the right foot. So you see it goes under the arch of the right foot like this. And you just hold on to the strap with your hands. So the strap needs to be long enough so that you can be comfortable. For the first set, see the foot here, it's vertical. Can you see it's like just perpendicular to the floor? You're not pulling your toes toward you. We'll do that in the second set. So the foot is just perpendicular to the floor. Leg is straight, sit really tall, and you can slightly lift the leg and push with your foot and pull with your hands. Sit really tall, don't let your shoulders lift up. It's quite strenuous. If it's too hard, you can keep your leg on the floor. Okay, leg down. We're doing this 3 times on each leg. As I said at the beginning, when you do this protocol of stretching where you push and pull, strengthen for 10 seconds, 3 times, it's not just stretching, it's building resilience. That's elasticity. So for jumping idea. Not that you can jump, but leg down. You don't want to be like the shuffle, old people shuffle idea. No, you want to spring in your step. Sit tall, leg up. Okay, here you have to be careful with the knee. Don't hyperextend your knee. The knee should be just a little bit bent. This really has a great connection also for your hands, right? For grip strength. Okay, now we'll switch to the other foot. So left foot here. Your foot perpendicular to the floor, just slightly lift. Don't hyperextend your knee. Knee a little bent. Sit really, really tall. Keep your head back. It's great for strengthening your shoulders. And breathe. Leg down. Recover a little. You'd like to feel it evenly with both arms. Try not to just use your whichever dominant arm. The elbows are straight. Don't bend your arms. Arms are straight, so you're evening out the tension in the thoracic spine and your upper back. Down. One more time. Good. So then you're pushing with your foot, pulling with your hands, and you're tall and strong. Recover. Get back to the right foot. So this time, as I said, this time your foot is more flexed. So you see this is my straight, and now you pull your toes toward you a bit more, okay? Whatever you can get. However, do make sure you don't twist your ankle. Then slightly lift if you want. You can keep your leg on the floor, or you can just lift it up a bit. And you're pressing and pulling. Your ankle is bent, your toes are pulled up. Leg down. Okay, flex your ankle. Pull with the strap, push with your foot, slightly lift. You should not feel this behind your knee. If you do, I would bend the knee a bit. And stop. One more time. Bend your ankle first, then lift and push and pull. Keep the shoulders level. Keep your body, your head and shoulders are centered. Be sure you're not twisting. Sit really tall. Recover. Okay, last thing for today. Left leg one more time. Yeah. Then we're all ready to go for your long walk. Left foot flex. Sitting tall. And lift. So this time your ankle's bent a little more, but don't twist your ankle. And if your ankle is a bit twisted, just try to arrange it so that it's straight. Like you can tell if it twists out a bit. Your toes should be pointing directly up. Make sure you don't let the toes go out. Flex your foot, lift, sit really tall, build up your shoulder strength. Release. Okay, one more time, last time. So when we do this, you're strengthening the nerves from your hands to your feet. So that means along your whole line of nerves from your hands to feet in your entire body, better communication, less interference. That means better coordination, better everything. And more competent in managing your life activities. Recover. Okay, great. Well, thank you so much for coming today. And we'll have other classes where we incorporate more weightlifting. Today was just really the series, what I would call the most important series for helping our bodies stay strong, preventing injury, back pain, knee pain, shoulder pain, all that. We don't need all those things in life. We'd rather play tennis and go swimming and gardening. Thank you, everybody. Have a great day, and hopefully see you tomorrow. See you. Have a good time walking today.